We wanted to check in with you, how things are going there at the Pacific Brain Health Center.
Yeah, things are going great. We are a multidisciplinary center with neurologists, neuropsychologists, and psychiatrists. I run a program called the Fit Brain Program, and we have individuals with and without cognitive and neurological conditions. It's sort of like a medical fitness studio where we have different devices and strategies for training the brain and body at the same time. We've incorporated a ping pong table, a robot, and some accessories. And we've been enjoying the game of ping pong in a therapeutic manner. We use everything from just teaching the game of ping pong all the way to adding cognitive drills and tasks on top of the ping pong tasks themselves.
I'd love to hear a little bit more about that.
Yeah, so ping pong itself is cognitively demanding. If you're not paying attention, you're not playing the game. And so for some people that aren't as experienced in ping pong, or they've lost visual or cognitive or motor capacities that make it difficult to participate, just the act of learning and playing is cognitively and motorically beneficial. And for those individuals that can just play the game, we now have permission to add cognitive demands on top of that. So that could be trying to hit a target or responding by switching from forehand to backhand, or maybe adding a cognitive task on top of what they're doing. It's like a heavier weight, if you will, cognitively to add to that, to train their brain's resources to hopefully be more efficient. And so it would be a cognitive motor dual task is what we're doing. On the motor side, we may also change what they're doing with their feet. So typically people take a self-selected, stable stance and maybe are stepping to the left and right to move their feet, but we might actually put them in a balancing task at the same time as they're playing.
Right, so that gets them off tilter, so they're having to focus on their balance while they're trying to go towards the ball. Can you speak a little bit more about why that's good for the brain?
So dual tasking does create this pressure for the brain's resources to be distributed a little bit differently. Once again, ping pong itself is already going to have these unique demands on brain activity and its resources. And when we add an additional dual task element, we might be activating the prefrontal cortex a little bit more and causing the brain to distribute resources in a slightly different and hopefully beneficial manner. And this is valuable for individuals such as ourselves that maybe want to improve how we distribute and allocate our attention. And it may be even more valuable for an individual where, because of a disease or a neurodegenerative or a neurological disease, the way their brain works responds therapeutically to that.
Right, that makes sense. So what type of patients have you been working with so far?
So we have people all across the cognitive trajectory. We have individuals that may just want to prevent dementia, that could be 50 and above, that are just concerned about preventing cognitive decline and conditions such as dementia. And they are excited to find out that ping pong has value as what's called a neuromotor activity, an activity that engages the brain and body. Other examples are dance or martial arts or tennis, but they find ping pong a fun, accessible, social, and surprisingly valuable activity. And so people are excited to know they can incorporate that into their routines. We have people who are starting to notice some changes in their cognition, but nothing is diagnosed, and therefore they're motivated to start addressing that. We have individuals diagnosed with mild cognitive impairment or MCI, and that could be due to potential Alzheimer's disease or dementia or Parkinson's. And then we have people with a certain type of dementia. That could be Alzheimer's disease, Lewy body dementia, frontotemporal dementia, or dementia due to Parkinson's. And every individual across that spectrum in every example does and can benefit from incorporating ping pong into their sessions with me, as well as into their everyday life. And in fact, a lot of the individuals that we expose ping pong to during those sessions often find a way to access it at home, whether it's a ping pong table they have and have not accessed, to going ahead and getting that equipment.
That's amazing. So really, I mean, anybody can really benefit from this activity is what it sounds like.
Absolutely. I haven't found anyone that cannot benefit, put it that way.
I'm thrilled to hear that you've been able to work in this clinical approach to using ping pong and developing really some of these protocols of how can we really maximize and the benefits. So do you find that your patients seem to be really looking forward to coming in and getting on the table with you?
Yeah, I find that a lot of patients coming in who are, and I could see this for other fitness services or physical therapy centers or services, that a lot of people might not be excited about facing their weaknesses and improving their capacities. And they're excited to reach their goals. They're excited for what it might mean for them. But to enjoy the process and even look forward to it is a really big deal. I've had a patient with also some dementia that was a really avid tennis player. And because of a specific type of dementia, has some very difficult walking or gait patterns that make him very at high risk for falls, especially when he's distracted. He could fall. And so to play ping pong is reminiscent of tennis for him, but he can access it. And it's something he's able to access at home as well, and feels that same athletic prowess and sense that he had during tennis, playing for all those years, but in the context of ping pong.
Right. But what you're saying too is that there's this opportunity to have a very systematic physical therapy, clinical kind of work being done in a clinical setting. But then you can take those skills and then you can continue to practice on your own, as you said earlier, with family and friends, or even on virtual reality. And you can also then take those skills that you're learning in the clinic and then play more competitively with your friends online or in person. So it's so fun that you can take a clinical and a recreational component to this movement.
Absolutely. I think the question is just like a home exercise program after you see a personal trainer like me or a physical therapist. The question is, what can you do on your own? And so for some people, that might be a virtual reality headset play. For some people, it's getting the table and not even playing with other people, just self-serving the ball and hitting it to the other side, or having their caregiver or significant other stand behind them and help them hit the ball, or
Right.
getting some accessories that make the ball more stationary in space and work on rhythm and timing. And so it looks different for everybody based on their stage of physical and cognitive capabilities, their technological savviness and willingness, and how they want to achieve their goals using ping pong as a medium. But one thing is for certain, nobody is opposed to doing that, and people very much look forward to it.
Yeah, and I guess like when you're doing something as simple, like doing basic balancing skills, if you're just by yourself standing on one foot and trying to do various standalone exercises, I imagine when you incorporate a ball and a paddle and you're trying to balance it, it just kind of makes that task just a little bit more engaging, a little bit more interesting to be doing exercises for physical therapy where they're standing on one foot or standing in tandem or something.
Yeah, in that example, those tasks are not that exciting. But for some people, those types of tasks are pretty challenging where it does require their focus. But at the point where it is starting to automate and we want to re-up the cognitive demand of that task, especially since the real world involves so many distractions and dual tasks anyway. So many people fall or trip while they're distracted. We don't fall typically because we're focusing on our balance. Otherwise, we wouldn't have fallen or tripped. Even I do this.
Right. I do too.
To train our body under distraction is not only engaging, but incredibly practical.
Yeah, I can see how that could be. And they look so simple. And then when I was like watching them being done, no big deal. And then you're trying and it's not easy, that's for sure.
That's right. And it's all about making the challenge meet the skill level of the individual. So a balance or the meeting of those challenge and skills is referred to as the flow state. It is a psychological state, but also it can be the intersection of your cognitive and physical skill and the challenge that's being posed to you. And I think what's important is wherever you're at, if it's too challenging relative to your skill level, you'll find it frustrating. And if it's too easy, as you described, you'd find it boring. So the art and the science is finding that intersection. Mm-hmm. And it's interesting because people's skill levels will develop and improve. So therefore, the challenge needs to get greater. And whether that's playing against better than you or adding a cognitive or a physical task on top of that movement or ping pong task, that's where that opportunity lies.
Right. There's always something to do different. There's always a way to make it harder or to switch it up.
But the unique thing about ping pong is that it's so globally accessible or universally accessible and can be scaled to incorporate so many of these elements.
Yeah, and that's one of our big missions with Ping Pong for Good is to make ping pong accessible to everybody. So more people are aware of the benefits, but also making it more accessible and the benefits more accessible by providing some of this instruction on how to really maximize the benefits to the brain and to your overall health. So no, I'm really excited about the work you're doing there and can't wait to get this program to more people and more people out there playing.
Absolutely. It's a great mission and I'm happy to be a part of it.
Well, so happy to have you with us and we look forward to checking in with you again really soon.
Great.
Thanks.